Exercise 2. Dissection of the fetal pig, the urinary system. In this exercise, you dissect a fetal pig to view the anatomy of the urinary system in a mammal. Important: because you will be using the fetal pig for multiple laboratory experiences, it is important to keep the pig moist, not wet, out of the reach of any children and pets, and to dissect the structures with care. Try not to tear or cut any structures of the pig that will be needed for examination in other laboratory exercises. Gather your safety goggles, gloves, face mask, apron, dissection tray, plastic container lid, large foam pad, dissection kit, dissection pins, paper towels, scissors, and duct tape. This is best performed near a source of running water. Sign and date a small piece of paper to use in your photos. The paper should be visible in all photos of the dissection. Prepare the dissection tray by placing the plastic container lid on the counter. Place the large foam pad on the lid and cover the foam pad with paper towels to absorb any liquid that may leak out during dissections. In a sink with running water, open the package with the pig inside by cutting the plastic bag completely across the top. Empty any liquid inside the bag. Keep the plastic bag for saving the pig throughout all dissections. Remove the pig from the bag and thoroughly rinse the pig under running water. Lay the pig ventral side up on the tray. Use the string provided to tie the limbs down and out of the way on the tray. Measure 2 equal lengths of approximately 18 to 24 inches of string to tie the limbs securely to the dissection tray. Loop one end of string around one of the forelimbs 2 to 3 times and securely knot the string. Pass the remaining string underneath the dissection tray and wrap the opposite forelimb 2 to 3 times and securely knot in place. The limbs should now be on the outside of the body with the chest region clearly exposed. Repeat the procedure to secure the hind limbs in the same way so that the abdomen and pelvic regions are clearly exposed. Access a scalpel, the dissection scissors, straight probe, and straight and toothed forceps. Have these next to the dissection tray. Note: when making incisions, always ensure that you have control of the scalpel and the pig. Turn the pig so it is in the most convenient position for you to cut, using as little effort as possible. Some of the dissections will be lengthy. Ensure that you are comfortable and can dissect for long periods of time. You will use one scalpel for many dissections. Dissection of the abdominal and pelvic regions. To dissect the abdominal and pelvic regions, cut lightly using your scalpel. Be careful to not cut too deep to avoid cutting superficial muscles. Try to just cut the skin. If you have already opened the thoracic cavity, begin the abdominal dissection from the most inferior point. If you are starting your dissection at the abdominal region, find the area of the ventral surface just inferior to the forelimbs. The diaphragm marks the boundary between the thoracic and abdominal cavities. From the center of this area, make a lateral cut across to the outside boundary of each forelimb. Thus, you have one complete cut from left to right just beneath the forelimbs. Make a midline incision down the abdominal region to the upper boundary of the umbilical cord. Make a circular cut around the umbilical cord, leaving it intact. From approximately the midpoint of the circular cut around the umbilical cord, make 2 lateral cuts, one to each side, to the proximal region of the hind limb. Between the forelimb and hind limb on each side, steps 1 through 4 will provide one continuous flap of skin to be reflected. To expose the abdominal muscles, gently lift 1/4 of the upper midline incision with the toothed forceps, the incision made in the center of the ventral surface between the 2 forelimbs. Use the toothed forceps to grab the skin and pull it away from the pig as you separate the skin from the underlying muscles. You will cut through some superficial fascia as you pull it away from the muscles. You may use your scalpel, metal scapula, or scissors to work through this connective tissue. Using the scalpel in the other hand, gently cut the skin away from the underlying muscles, providing slight tension by pulling the skin gently away from the surface. This process will allow the skin to be reflected away from the muscles, but maintain the skin flap to cover the abdominal region when not in use. Use dissection pins to hold the reflected skin open. The dissection pins go through the skin and are secured into the foam of the dissection tray. The skin of the pelvic region near the hind limbs can be difficult to dissect in one section. Therefore, it is often dissected in smaller sections for ease and to maintain integrity of the structures. Opening the abdominal and pelvic cavities of the pig. Once the skin of the pig has been reflected, the goal is to open the abdominal and pelvic cavities to view the digestive and urinary organs. To open the abdominal cavity, use the scalpel to cut through the muscles. We will follow a very similar strategy to open the abdominal and pelvic cavities as was done to reflect the skin. Pressure will have to be applied carefully to cut through the layers of muscle. Be careful not to cut too deep, so as not to cut through underlying structures. Make a midline cut from the diaphragm to the umbilical cord. Make lateral cuts from the midline of the diaphragm out to the inferior lateral regions of the left and right forelimbs. Cut approximately halfway toward the back. Make a cut around one side of the umbilical cord and continue the cut midline toward the anus. Make diagonal cuts from the midline anus region around the ventral side of both hind limbs. The cuts proceed from medial to lateral. Cut approximately halfway toward the back. Use the straight probe or scalpel to gently cut through any connective tissue to allow the layers of muscle to be fully reflected to the side. Use the dissection pins to secure the reflected muscles to the foam on the dissection tray. Using paper towels, gently mop up any excess fluid found within the abdominal cavity. Alternatively, you may wish to rinse the abdominal cavity in a sink. Be sure to flush with plenty of water. Pat the structures and regions dry with paper towels. Do not leave any standing water in any body cavities. Be sure to completely clean the sink with a 10% bleach solution if you choose to rinse the pig in this manner. Remove the fetal pig from the storage bag and remove any paper towels covering the pig. Place the fetal pig on the back with ventral surface facing upwards. Secure the limbs away from the midline by passing the string secured around opposing limbs string underneath a dissection tray. The ventral surface should be fully exposed. Open the cut abdomen of the pig. If you have not dissected the abdomen yet, refer to the appropriate directions for complete instructions on how to open the abdominal cavity of the pig. With the abdominal muscles reflected, the organs of the digestive system are fully viewable. You should be able to observe most or all of the following: liver, stomach, pancreas, spleen, small intestines, large intestine, and mesentery. Carefully move, reflect the intestines to one side to view the kidney. Note the thin membrane separating the intestines from the kidney. This is the peritoneal membrane. The kidney is retroperitoneal and thus lies posterior to the peritoneal membrane. Note the position of the kidney on the dorsal, back, and lateral, outside, side of the abdominal cavity. Notice the size and shape of the kidney. Reflect the intestines to the other side and view the retroperitoneal kidney on that side. Note the similar orientation to the kidney on the opposite side.